So those are some good stories. And we're going to have some of our own. So our first speaker is going to be Walt Garvin. And Walt worked at AT&T, which of course became Lucent and became Aegir and all those things for 30 years. And he retired, and at some point they terminated his health coverage, which was not the plan, as I understand it, originally. So he's had to go out and find insurance, and he's going to tell us how that went for him. Walt?
Thank you, Mark.
Thank you.
All right, good morning, everybody. My name is Walt Garvin. I currently live in Bethlehem Township, but when I first moved to Lehigh Valley some 36 years ago, I lived in Center City, Allentown, and I'm delighted to be back here. Sacred Heart Hospital was then and still is a great resource for our community, and I'm delighted to be here. So, like many of you who pay attention to this healthcare system that we've been involved in, it hasn't always been the best for people looking to get health care. Like many people, working class, I've worked my entire life, and during that working years I had health care through my employer. The employer kind of buffered you from really what the costs were, but anybody who's paying attention has seen their cost increase, their out-of-pocket costs increase, their contributions towards the plans through their employer. Now, my particular case, as Mark alluded, I worked for AT&T Lucent Technologies as a manager, and back after they shut down more or less, I went into retirement, and they decided that they were going to do away with health care benefits for their management retirees. It's almost comical. They couldn't do it to the representative associates because they all had contracts that they had to adhere to. But managers take the long and short. They do all the bidding of the company, and then they take the downside. So they decided to do away with health care benefits for their management retirees shortly after 2003, 2004, which was bizarre on its own. So that made I had to go out and look for health care coverage on my own. And became familiar with that. And again, anybody who had been trying to look or had been buying healthcare insurance saw double-digit increases every year for the past decade. So this is long overdue, and I'm delighted that I have a personal story that it could be emblematic for a lot of other people to get out there and find out what's really happening. And it's not listening to the hype, but actually what has happened. So. Because I do purchase my own health care insurance, I am and was a candidate for the Affordable Care Act. So back in October, I went up to the healthcare.gov website to see what was happening, and like many people, experienced some access issues. They're all well documented. But since then, it's been excellent for me. November the 3rd, I went back up onto the healthcare.gov website and was able to establish my account, take a look and shop for healthcare insurance based on my particular needs, and logged in and out of the website multiple times since then, without a hitch, without a glitch, without an error, no nothing. It was perfect for me. So after doing my due diligence with the carriers that I was looking at to make sure that they had, covered the hospitals, the doctors, and everything, and I'm a fairly healthy individual, I was able to get healthcare insurance through the healthcare.gov website. Not only that, but I was able to save over 40% of my current carrier in the Affordable Care Act. Because of the competition, I was able to reduce my costs by over 40%, which is incredible based on what I was saying. For the past decade, people have seen double-digit increases every year. So anyway, I selected through the website my coverage, got the connection. They contacted my new carrier. My new carrier issued me an invoice. I paid that invoice, and bang, this was back in November, December. I'm now covered 1/1/14 under the Affordable Care Act, and I couldn't be happier. with the results, both of the process and now being healthcare coverage that, it's affordable. For me, it's affordable. You know, there's access issues, affordability issues, and quality, and I'm able to take advantage of every one of them. So, you know, I couldn't be more delighted with the process, with the coverage. You know, the people who made this possible, President Barack Obama, our Democratic Congress, because they were the ones who shepherded this thing through the legislative process. The Republicans were all involved with it. They had their comments. But when it came time to vote, none of them voted for it. So the Democratic Congress, the president deserved all the kudos for this. And Health and Human Services, because they were the ones charged with implementing it, my hat's off to them as well. Now, we're going to see this thing improve every year. Similarly, like Medicare, when Medicare was instituted back in the 60s, and Social Security, it'll get better every year because it's something that everyone needs. Everyone has a right to affordable care and just care in particular. So not only am I covered, my son, he's 24 years old. So while he was a college student, he was able to stay on our plan because with the Affordable Care Act, up until the age of 26, he could stay on our plan. And we paid for that, but you know, he didn't have to worry about that. He's now an enrollee also in the Affordable Care Act. My rates, again, with 40% less without any subsidies for Kevin, my son, our son, his policy is $68 per month, and for a young man, you know, that's a beautiful thing. So again, I couldn't be more delighted, and the more people that hear stories like mine, which is 100% true, no embellishments. It's important that they do here because there's enough noise out there with people poo-pooing this whole thing. So the insurance companies are no longer the main driver of healthcare insurance, but the Affordable Care Act is helping them, you know, deliver affordable care to people. So again, that's my story. I'm delighted to be able to tell it. I thank Mark, I thank Sacred Heart, and you folks for being here to listen to it.